All right, we'll go ahead and get started. So I know that we have a few people who may have not attended in the past or you've attended once. So in the chat, if you could share your name, your institution, and your location, just to get a sense of where we are as we get started. So our agenda for today, our regular introduction, so in the news, followed by a warm-up question. Then we'll go into a few announcements, pretty brief, one on the IMACS rename and next opportunities. And then we'll do a quick events and conferences roundup. We have Dr. Sheetal Salal covering the Code for Science and CSNS, Code for Society and Science, and the Wellcome Trust workshop that was hosted in Cape Town, and the AGU Chapman Conference on Climate and Health for Africa that was hosted in DC last week. So I can provide some brief updates on that, and we'll just have some open discussion. So starting with in the news, I wanted to share just three things that I saw in the past month that may be of interest to catch your attention. So I think yesterday there was a publication in the Washington Post, kind of a photography story of the situation in Peru. You may have seen this kind of in the news recently. And I thought this photography series captured some of the situation in a different way. I'll quickly share my screen to show that if you haven't seen it. So there's a very large dengue outbreak in Peru, and largely the story is focusing on how climate is worsening the outbreak in Peru and the impending El Nino cycle that could potentially make it worse, with the climate becoming, the environment becoming more suitable for mosquitoes. So in this series, they're covering the public health response, the fumigation, and patients, the hospitals. And I think this is kind of a compelling way that they've been trying to highlight the situation, an emergency situation in Peru, and something that's quite relevant to our work as we're doing work in health and climate, in infectious disease, and looking at the human impacts. And then another piece of news I thought was relevant, an op-ed from Vanessa Carey, just another way that climate and health is becoming more and more prominent in the global health space. Vanessa Carey, the CEO of Seed Global Health, published something at the end of May around the health day at COP28 and the impacts of climate change on health systems, how it's essential to have interventions be climate informed, and that responses to climate change need to be accelerated, mentioning the global stocktake. So a lot more engagement from the health community and a lot more excitement around COP and the health day there. And then the last publication I wanted to highlight in the news is this publication from Dr. Sadie Ryan, who is also part of the expert network. Dr. Ryan published something in the Lancet Planetary Health earlier this month on software tools for climate-sensitive infectious disease modeling community. So a lot of early warning system type of tools. So this was a personal view post, but some of the findings are quite interesting, and I'd be curious to get your take on, some of the criteria that Dr. Ryan used for identifying these, what she's calling fully developed software tools. There are 37 she found, and most of them for infectious disease, and among infectious disease, a lot of them for malaria, and that there was a gap in tools for respiratory, foodborne, and waterborne diseases, and no tools from this landscaping for soil-borne diseases. So a lot of interesting stuff there. I think more than half of them were free and operationalized, fully available online. So really interesting stuff. I know that Kaushik and Rishabh and the IMACS team had been working on a similar survey, similar study, specifically on malaria early warning system tools. And so it's interesting to see this in line with some of the work that's been happening here. Any other publications from this group that you want to highlight, or any responses to these three on the page?
Thanks, Grace. I'll actually go respond right off when I'm giving my update on the meeting in Cape Town. Thanks.
Sure, sounds good. All right, if nothing else, I'll move straight on to the warm-up question. So this is just something that I've been introducing to this group to get some of the conversation going, get to know each other if you don't know each other already. So for our quick warm-up question today, I'll ask everyone to unmute, just give a quick answer to this. So working in climate, health, and modeling can be relentless, as with many fields, but I think especially right now, how do you find time, or how do you rest and recharge? So I'll just go down the list here. Shital, would you mind starting us off?
I'm at a loss to answer your question properly. I think more recently what I do is sort of just prioritize the time that I need to get to bed and only go past an hour of that or so, and eat well and try get enough sleep, and then take a holiday where you can.
Yeah. I mean,
and pet cats and dogs, it really does help with endorphins.
Yeah, you're covering the fundamentals here. It's a really good reminder. Kaushik, what do you do? Kaushik, maybe. Okay, you're muted.
Hello.
Yep, can hear you.
Hello.
Kaushik, can you hear us from your end?
Am I audible?
Yes.
Sorry, I can't hear anything. I'll rejoin. Just a second.
Okay. How about in the meantime, Rishabh?
Hello. Sorry. Okay, so rest and recharge. That's quite an interesting thing to talk upon. But I don't have anything in mind to get rest and recharge, like normal stuff, doing the hobbies, watching Netflix. That's what I can do to rest and recharge. I don't have anything in mind. I'm just blank. Maybe someone else can fill in and I can just jump in later.
Yeah, we'll go back to Kaushik. Can you hear us now?
Yeah, I can hear you all now. Sorry for the glitch. Am I audible now clearly?
Yes, you are.
Okay. Yeah, so I rest and recharge. The only thing that I do is kind of reading ebooks. Previously, I used to read books. Now, these days, I primarily read ebooks a lot, and those ebooks are mostly related to kind of big picture ideas. So, there's a nice book called Undisrupt, which talks about disruptive innovations and how using disruptive innovations you undisrupt stuff. So that's the book I'm reading for the last 3-4 days. So that's what I do. And other than that, a little bit of coding. So that's a profession for Rishabh and a hobby for me.
Thanks, Kaushik. Sounds like a kind of productive way to rest and recharge on your part. Marlies?
So I have my morning coffee, first cup of morning coffee, sitting outside in my hammock and looking into the greenery. And then as often as we can, our family likes to go camping in the bush.
That sounds quite peaceful. Thank you. I would love to have a hammock, a morning hammock moment as well. For me, I like to bike. I think biking is one way that I feel a bit liberated from some of the working and the kind of the transportation systems that are around me, especially in California. So that's what I like to do. All right, thanks everyone for sharing. I got a few ideas from there and some envy about hammocks. All right, so our first big announcement today is our new name for IMACS. You may have or may not have noticed the new logo on the title slide. We've renamed IMACS, formerly Institute for Malaria and Climate Solutions, to Institute for Health Modeling and Climate Solutions. Most of the branding will remain the same, but the name is just a reflection of the feedback we've heard over the past year around this group being interested in health areas beyond malaria and how malaria early warning systems are related to dengue early warning systems, are related to other health warning systems. And we've seen that kind of interest expanding and that emphasis being pretty clear across the community. So we just wanted to be responsive to that and know that health modeling and climate solutions would be kind of a better focus, a broader focus, as we're trying to expand and invite more folks into the network who we know are doing very interesting, very important, fascinating work at the front lines. Kaushik, did you want to add anything else with this kind of thinking behind the name change?
Yeah, so rather than, so you talked rightly, Grace, that this is not only about malaria, and because Marlies and Sheetal just joined and they might not know how Forecasting Healthy Future in section was there and why we essentially thought of Institute for Malaria and Climate Solutions and why it happened to Institute for Health Modeling and Climate Solutions. So just a brief recap of what has evolved. So we were doing we created a precision programming model for malaria elimination a few years ago. And in 2019, when we were implementing that precision programming model, we found a challenge that, the frontline health workers, they are unable to provide services to the last mile due to certain weather challenges. And this is not something which we went to the ground and saw. So this came up with a little bit of digging down of data. So what happened was, as you know, that malaria cases peaked during the period of monsoon. And we were trying through the patient programming model some targeted interventions to strengthen malaria surveillance, improve access to detection and treatment. And for that, we were analyzing the pattern of surveillance in some of the highest endemic areas, especially in India. And at that point of time, we found that the malaria curve was kind of U-shaped in those regions, rather inverted U-shaped, where during from the period of January to May, there was a rise, and then it peaked around July and August, and then starts moving down. and it went touched bottom line nearly around November, December or so. But if you see, when you check their testing pattern, the testing pattern was exactly opposite. So the testing pattern was the most number of tests, or the highest number of tests used to be done in the month of January, February, March, and then again in October, November, December. So it was kind of surprising for us. And then we realized that especially during the time of monsoon, when there used to be heavy rainfall, these geographies, there were certain geographies which used to become surveillance blind spots. So what is happening there, you never knew. And that became the super spreader zones from where malaria used to get spread in the surrounding region through horizontal spread. So that's why we developed this data-driven platform to address this threat, and also started an initiative to address some of the challenges. The first objective was to address the challenges that the frontline health workers face, but the second one was how we could improve the planning of different malaria interventions, campaigns that happen to ensure that interventions are effective. So that's how Forecasting Healthy Future inception happened. And in 2020, Forecasting Healthy Future was launched with two primary objectives. The first objective was that we will conduct a level of advocacy, bringing together the voices in the global health, technology, and climate space. And the second objective was we will drive innovation using digital transformation to address the growing threats of malaria due to climate change. And it was primarily focused on malaria. And at that point of time, I think in 2021, after a massive body of technical work, we launched the Institute for Malaria and Climate Solutions. And the job was to innovate solutions on that front. We also brought together this network of experts from several organizations. In India, we convened an interagency expert committee with the Meteorological Department, Indian Council of Medical Research, and also the different health departments and of the state governments. And while this was going on, Forecasting Healthy Futures advocacy work was paralleling, and we really started the advocacy work, I think, in more or less mid-2022. And we realized that it's not, if we just focus on malaria and climate change, we won't be able to make the massive impact. There is an urgent need where we need to address several stuff. So number one is health system strengthening. Number two is the nationally determined contributions of the different governments as they allocate the funding to the climate finance to different service sectors. At the same time, how multilateral donors and development banks are thinking about providing resources to the health climate intersection. What could be the best bet solutions for addressing these challenges that are growing because of climate change, frequent weather hazards, and the other impacts of El Nino oscillation. So it went. It actually changed the direction more after we visited COP28, because that there we found our understanding more on what exactly climate people think and how they're working, where the climate adaptation resources are being spent, what could be the solutions to address the effects of climate change going further. And based on that understanding, FHF took a lead role at this particular intersection earlier this year when we convened this summit. And there we worked hand in hand with the UAE leadership, who is working in for the COP28 part, and then we kind of leveled up our strategies, started supporting at a more global level, and we also translated our India program to a much bigger scale in Indonesia, as we formed up a partnership with one of the leading AI agencies, which is kind of a semi-government, semi-private organization in Indonesia, and right now we are working there at a very high level with 4 or 5 different ministries. And now we felt that it's not only about malaria, so the name definitely needs to be changed. So that's where Institute for Health Modeling and Climate Solutions actually came in, which this was really talking about, it's the prediction and planning tool, or maybe early warning system that you develop for malaria. It is very similar system as you develop it for dengue or maybe cholera or influenza or any other disease. And even heat early warning system or air pollution early warning systems are very similar. It's just that how you change the data and how you model them. But then the interventions differ, and we need, if we are to strengthen the health system, it need not be a vertical solution. It should be a horizontal product that kind of provides umbrella solution to the governments of different countries. So that is the reason we kind of changed the name, but we felt that the acronym was, we were really very, brainstormed for this particular acronym, and we all love this particular acronym, IMACS. So that's why we kept the acronym same, but Institute for Health Modeling and Climate Solutions with H silent. So that was the kind of story behind how FHF evolved, and IMACS, Institute for Malaria and Climate Solutions, and then we have now become the Institute for Health Modeling and Climate Solutions. And thanks to all I think there are 42 or 44 scientists now from 25 countries in this particular network. We are thankful to all of you for representing us in different platforms and forums, and it's an honor to work with all of you. And we believe that working together, we will be able to advance the science and technology part, which is one of the pillars of our body of work at IMACS. So that's it. So it was a kind of a long monologue, but sorry for that. But thank you.
Thanks, Kaushik. I'll just echo that just being interacting with everyone in the network has been a really great learning experience for me too. So we appreciate everyone in this group. All right, we'll follow that up with some upcoming opportunity announcements. So the Belmont Forum proposal call for collaborative action is still open. The pre-proposal application is due July 15th, so just under a month to apply for that. We've been kind of carrying this over as an announcement for the past few months, but I've also seen it pop up as a key announcement in some of the other forums that I'm a part of in climate and health. It was announced again at the AGU conference last week, so it does seem to have a lot of energy behind it at this moment. And it really is, from what I've seen from other projects that have been launched through the Belmont Forum, the previous call for climate, health, and environment. It really is a collaborative and interesting model. Yeah, all different organizations and institutions from different countries are working together, but then they are funded by folks who in country. So whichever funding agency is based in the country that they're working in is the funder for them. So there could be, just even on this call, organization in Thailand and one in South Africa and the US all working together collaboratively, but funded by different organizations based on their funding model in the Belmont Forum. So very interesting model there. And then the next one is the Burroughs Wellcome Fund Climate and Health Interdisciplinary Awards. This is something new that our new Forecasting Healthy Futures Director had found. I can quickly switch screen to share a bit about this. So this is a grant that's due later this year, August, and looking at multi-disciplinary, multi-investigator, individual scientists. The grant is for a total of 3 years, and the total amount of the award is $375,000 USD. This seems kind of new, so it's interesting to see this here. Seems looks like this program is based in North Carolina in the US. So another interesting opportunity here. It seems like they're also emphasizing early research early career faculty, postdoc fellows. So if there are any folks in your teams who may be good candidates for this, I'd recommend sharing this with them.
Sorry, Grace, a quick question. Is it open to applicants from around the world, but just hosted by a US organization, or is it open, or do you need to have a US PI?
That's a good question. I'll look through
I mean, I can
this.
look into it myself. I just wondered if you knew offhand.
Yeah, I was actually going through this to check, but let's see if I can do a quick search on eligibility. Yeah, it's not saying fully here, but if I find it, I can send it to you.
Thanks.
Sure. All right, so we'll go ahead and move on to our next portion. And hi, Richard, welcome. Thanks for joining really late to your time. And I'm doing a quick events and conference roundup here, Richard, and I know I'd asked if you could do ones for the conferences you'd attended. So if you are available and are willing to do that as well, then be open to hearing those reflections. But first, we'll start off with oh, sorry, Richard, were you going to share if you're available? All right, maybe in the chat, I'm not sure, Richard, if you will be available to be on audio, but let us know. But first, we'll start off with Shital and the conference or the convening in Cape Town for the Code for Science and Society and the Wellcome Trust. I know that I talked to Dr. Zhang, who is working on dengue in Vietnam. He said that he had also attended this. He's newly joining the network, but is busy doing field work, as many academics are this summer here. And then I'll go into the AGU Chapman Conference that was hosted in DC. And then we'll hear from Richard as well. So over to you, Shital.
Thanks, Grace. So this meeting that was held in Cape Town in May was a direct outcome of the paper that was published that you flagged earlier this week, Grace. So that was the Wellcome Commission study on the Wellcome Trust Commission study on the CSRD modeling landscape and the tool landscape. And as a result of that report, which was initially published last year sometime, it's just the paper that came out this year, there was a call last year on by the Wellcome Trust to be submitting applications for digital tool development as a direct response and encouraging LMIC led projects. Apologies, my cats are meowing in the background. And so once the awards were made for that particular call, they then through Code for Society organized a workshop in May for the awardees, as well as whoever, I guess, I'm not sure how wide they really cast their net, but it ended up being about 40 people, not all of whom were awardees, but who were somehow involved in some aspect of modeling. And it wasn't so much as a malaria focus as I thought it might have been. I think there were maybe two or three malaria modelers. There was one climate modeler and a lot of I think analysts and modelers from other disease backgrounds, but for a CSID workshop it was quite underrepresented from the climate side. And so the scope of the workshop it had one major aim, which was to discuss how to develop a community of practice for CSID modeling. And so many of the projects, at least the one that that I'm leading from this Wellcome Trust grant, involves setting up a community of practice around a tool that you're developing anyway, in order to sustain the tool and encourage its use. But here we were talking about trying to set up a general community of practice, but thinking along the lines of the bare bones to set it up, the kind of governance structures, how to be inclusive, so really trying to take it from a bottom up approach, as opposed to importing traditional designs on communities of practice. And so the discussion really centered around, how do we sustain open source scientific software? How do we build a sort of community-based solutions and develop networks at scale as well? So in many cases, there were some participants who were purely on the academic side and not knowing how to take their products forward and make them usable. Others were didn't know how to reach end users or clients. We even had some representation from policymakers in the room, and that provided a good perspective in terms of bringing research to the client. There was a lot of discussion on data sharing infrastructures, on open data, and the challenges faced around the world. And so the first sort of discussions were on what is the scope of this particular CSID community of practice. In terms of participants, it was decided that we needed to have both the disease modelers as well as a good representation from climate modelers. We needed some of the client perspective there as well. So public health specialists who are the traditional sort of clients, as well as your public and community representation as well. With respect to diseases, the focus was, it was decided not to restrict or not to include non-communicable diseases, but to leave it at CSID modeling only, so just infectious diseases only. There was also discussion on on principles of data sharing and infrastructure. And it's not that it was necessarily concluded, but it was good that these issues were being discussed. So for example, as well, where countries don't wish to share their data because they would prefer local analysts to be working on the data and publishing from it and so on. These to take these considerations and reasons for not sharing data into account and so on. There were also breakout discussions on how to bring, what kind of formats are required for digital tools in order to make them usable by decision makers. Should they even be usable by decision makers? Are there different kinds of tools necessary for that a decision maker needs in hand compared to what something else that is translated for a decision maker? And so I think a lot of the focus in this meeting was very much on your emerging your sort of forecasting type models, not so much on some of the work that some of the scenario based type of models where you're focusing more on strategy design, on cost effectiveness analysis and so on. Those were largely not really thought of in terms of sort of the policy aspects and supporting decision making in that way compared to forecasting outbreaks. So endemic disease support wasn't quite focused on, but those of us in the room who engage in this kind of work made sure that it was a part of, and a very important part of CSID modeling. There was also discussion on the governance structure, and in particular, I led a session on, what does equity look like in a community of practice? It's very easy to set a community of practice up in a way that unintentionally but systematically excludes groups from a population, even something as simple as time zones or time of day when meetings are taking place and so on. But in terms of not just representation, who's a part of it, but what do measures of success look like for a community of practice? And then the meeting, it was a 2.5-day meeting, which ended off with a good discussion on plans for the next year. And I don't necessarily want to communicate those because we haven't received the official feedback report. We will in the next couple of days, and I'll share that with you when we do have it. But there were plans to now set up set up the community of practice. Sort of right now we have a .io site for further communication and sharing of information and so on, but already sort of thinking along, how do we set this up? How does one govern this? What will the rules of engagement be? And so on. So it was quite productive in that it wasn't the kind of conference where you sit and listen to presentations. It was a workshop where you sat and discussed and actually did work the entire time. So yeah, that was it from the CSID Code for Science workshop. Like I said, it was a smallish group of about 40 people, but a healthy start to thinking around developing a CSID community of practice.
Thank you so much for sharing that. I think there are a lot of interesting and similar themes that I've noticed at the Chapman conference. I had talked to Angela Okune, one of the organizers from the Code for Society, and we were kind of discussing similar challenges with finding kind of the climate scientists in the health climate intersection. It might be because I'm still fairly new and kind of searching the field right now to find folks who are interested in that collaboration. I know they're out there, but it seems like a lot of the kind of people at the forefront at this climate health intersection were folks focusing on the health side of either health modeling or implementation or response. It might just be like the face of climate health right now is more health, because that's the end impact on human health. So that was an interesting kind of overlapping challenge that I noticed. Do you sense a similar kind of challenge in the work that you do, or do you think that the climate scientists or climate world is pretty engaged at the intersection?
I think it's the traditions of academia where you're still operating in silos. As malaria modelers, we don't tend to work with, we'll do climate modeling, but not engage with climate modelers. And it's the same for climate modelers. And it was through some of that exposure of having to review some papers by climate modelers where, as a malaria, sort of as a disease model, you could pick up all the flaws of, where the health system and so on were not taken into account, but climate was modeled very well, just not the health system and the disease aspect of it. And in the end, actually reached out to authors and from similar groups to work together. So the project that we're leading for the Wellcome Trust at the moment to develop a tool for malaria is with the climate modeling group and with the disease modeling group. So it's an active participation. So, I think it takes little engagements like that to start changing the face. In fact, you might have met Lisa van Arden. She was also at this meeting and at the CSID meeting. So she would have known Angela as well.
Oh, neat. Okay.
Yeah.
Yeah. And I was going to say at the AGU Chapman conference, it did feel heavily more climate scientist focused, which was a great change for me. Of course, the health community was still there, but there was definitely a better balance, possibly because AGU has that audience in their membership already. But it was an interesting couple of days. I guess I'll just kind of do a quick debrief on the AGU conference, and then I'll pass it to Richard. But it did feel more climate scientist heavy than the previous conferences related to climate and health that I've attended. So this was the first AGU conference on climate and health in Africa, so the inaugural of this version. And it sounded like they're interested in hosting this again. There's a lot of energy coming out of this. And I think the last day was the kind of cumulative effect of all the traditional kind of panel presentations that most of us are used to in a conference setting. So it was the first day kind of an overview of everything, followed by kind of early warning system was the through line. So early warning systems on infectious disease on the second day, early warning systems for heat on the third day, and the last day for workshop kind of discussion type setting of what can we do with all of this? What are some actionable next steps, realistic, feasible next steps from here? But so throughout the week, I did realize that there was a lot of technical knowledge in the room on climatology and meteorological services, lot of early warning system experts who either were kind of in the kind of project phase of developing something that can be operationalized, and a few that were operationalized and implemented. And one of the themes that I noticed was that most of the climate scientists, and rightly so, and mathematicians rely heavily on health professionals to interpret and determine the level of vulnerability and health risks that come out of kind of their climate models. So the uncertainties that come out of these models are left to health professionals to interpret for the population that they serve. And that's kind of one of the a through line through all of these conversations that I've noticed, like the communication between the health community, climate community is lacking. And when you leave a certain level of uncertainty for one group to interpret for themselves, then it doesn't quite end up that there's just something lacking. So that was one of the big gaps that was recognized, that we don't have enough health professionals who are well versed in climate to accurately determine the risk levels of an acute or pending climate event. We don't have enough climate scientists who are well versed in health to understand how to communicate these uncertainties that may have an impact on health. They need to be better aware of the thresholds to alert and how to alert health professionals. And there's a lot of conversation on how to bridge that gap. One of the interesting points that was raised in my small group was that there's this big focus on forecasting, and a lot of the work that needs to be done to bring in policymakers and to provide some evidence is to look at maybe nowcasting, so what's happening now, and how that type of nowcasting, immediate kind of alert system can lead to, save lives and improved health outcomes. So to start there, to build an evidence base, because all of the forecasting models do require a lot of heavy investment in research, but that type of investment has to start by getting the money. We also had some donors in the room. There was representation from USAID and NOAA and other NSF. They were all funders for some of the projects in the room. So it was nice to have that type of representation there, so they can almost speak directly to that audience to share what was needed. But it was quite an active week, I would say, and illuminating on my part to see a lot more of the climate scientists looking to be actively involved in the climate health work. And kind of to your point, Sheetal, like just active networking and active outreach to be inclusive and to foster that sort of collaboration is definitely what's needed. Any questions on for Sheetal or myself before we move on to Richard? All right, Richard, the floor is yours. And you had attended 2 events, is that right?
Thanks, Grace. Yeah, apologies for background noise. Yeah, so the first one was last month, and it was the rollback malaria surveillance monitoring evaluation reference group. So that's the global committee that I'm part of. We co-hosted the meeting in Bangkok, the Thai government, and the purpose of it was to bring African malaria programs across to Asia to learn from what the programs are doing here, collecting really high quality detailed surveillance data. So there's lots of discussions about how to improve the quality of the case data that's collected in African countries, and we had to monitor that. And it included the Gates Foundation and Global Fund, the Victoria Media. It's quite a high level meeting. And it was also, there's a new board for rollback malaria. It's a global organization that works closely with the virtual, and they're reorienting their strategy going forward. So this is the time to have a rethink about what they should be focusing on. So there's an action plan was drawn up for what to prioritize over the coming years, and that will be a document again. I can share that when it's finalized. But there is a lot of focus on trying to continue to bring different parts of the world together to learn from each other and try and bringing more funding to facilitate that. So having more conferences and meetings and more direct input from policymakers and what everybody does, including academia. So the other meeting was the Asia Dengue Summit, which is a global annual meeting that the dengue research community and National Dengue Program staff and funders they all get together. Again,
Sorry,
this time it was in
Richard.
Bangkok.
Seems like
Can you
we're
hear me?
having some issue with the audio. Do you know if there's any way you can
Is
kind
it
of,
cutting out?
oh, you're a little clear right now.
Okay, sorry, might be the connection. So, yeah, so how far did I get? Asian Dengue Summit.
Yes.
Yeah, so it's an annual meeting which rotates around countries. This year was in Thailand. With about 500 people that work on dengue. And it's very broad, covering all different aspects. But I was invited to present on the global update, and we talked quite a lot about predictive modeling and disease burden estimation and short-term prediction for control, but also longer term with climate change. So that was a major topic of discussion. And we had a couple of side meetings of the modelers that were there to talk about prediction modeling. And some of those tools are part of that Welcome Trust community that Sital mentioned. Some of those scientists are understood that scheme, but there's a range of other tools being developed. The governments from quite a few countries were represented, but they had scientists as well from those same countries working closely with those governments, which is good to see, including Thailand, Indonesia, Philippines, Malaysia, and then a few from further afield. There's people from the UK and the US as well, in small numbers. And most importantly, there are three major networks that support work in dengue that don't usually come together, but all three of them were in this meeting, and they all discussed together how to bring together the community in a more regular way. So that it was really nice atmosphere, lots of plans for collaboration and lots of discussion. And then on the Saturday, so last Saturday, a group of us were invited to go and visit some of the dengue hotspots in Thailand. So we were hosted to go and visit how they run their surveillance and how they run trials. And a big focus of the meeting was that there's a new vaccine for dengue, which is now being licensed in a few countries. And there's a lot of need to try and use data to target where that vaccine could be used best. So that includes predictive modeling, potentially including climate in those models, to know where to prioritize as it's rolled out. That's it.
Thanks, Richard. Yeah, you got clear at the end, so I caught most of that stuff at the end. And we said that there was interest in incorporating climate into some of these models or some of the work that's being done. Is there some element of that that already exists, or is it like to add onto it? What is the capacity of climate integration already?
Yeah, there is. So there's quite a few modeling efforts where they're using satellite data to try and make predictions from various different sources. And there's been some efforts to use climate change modeling outputs, but they're usually published outputs, so they're not collaborations. And some of the new things that were presented in the meeting are newly formed collaborations between climate scientists and dengue modelers. So it's starting to happen.
Yeah, that's interesting to hear. Kind of all of this is kind of happening simultaneously, regionally all over. It's interesting to see and hear about kind of a global but very local trend for climate and health type of modeling. Thank you, Richard. Any questions for Richard before we wrap up today? All right. with that, I think we'll conclude our June convening. Thank you all for joining at your various time zones. I know afternoon and quite late for Richard and Rishabh and Kaushik. So thank you all for joining, and I'll make sure to follow up with the links to the articles and the link to the recording afterwards. And I hope to catch you in the next one.
Thank you, everyone. Have a good day. Good evening.
You want to do some review of
Thanks.
Thank you.
social best
Thanks,
practices?
everybody.
Push stuff together
Bye.
so that you're-